Good afternoon, everyone. Welcome to today's town hall. We'll get started in just a minute. Going to leave a moment for everyone to join and get logged on and make sure that everyone has audio, etc., and is ready for the updates today. We've got another great agenda today for sure, with lots of important information about what's going on at all of our sites and as well what's happening out in the world around us that's impacting what we're doing. Our participation's rising well. So I'm going to kick things off formally. Good afternoon. I'm Aaron Levo. I'm the Vice President of People, Culture, and Communications. Happy to play a moderating role for today's town hall. Just a little housekeeping right off the top to remind everyone that we do have the Q&A function open today. So you'll be able to write questions in the Q&A function, and you can read the answers to those questions in the Answered tab within the Q&A function. We'll try to reserve, please, our chat function for our celebrations, which we'll have at the end of our formal agenda today. Once our presentations are done, you can think of something that you'd like to remark upon, or someone that you'd like to celebrate. And please, you'll have the opportunity to either type that in the chat, or you can raise your hand and we'll give you the chance to give your shout out live on our town hall today. So Q&A tab for questions and chat function later for celebrations. So we'll get right to it. Our president and CEO, Rob McIsaac, is going to kick things off. So Rob, over to you.
Thanks very much, Aaron. Happy New Year, everybody. Welcome to our first town hall of 2024. Maybe I'll start by, as always, acknowledging that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. We recognize and respect the presence and stewardship of all Indigenous peoples as keepers of this land. So it's wonderful to see so many people here, and I hope many of you would have had the opportunity to disconnect from work a little bit over the holidays and spend some time with your loved ones. I'm going to begin today with an update on HHS's strategic plan. And the plan has been refreshed for 2024. You know, we're operating in a very dynamic environment, and so we need to make sure that the strategies that we're pursuing are continuing to respond to the environment that we're operating in. Our plan, as many of you will be aware, describes the priorities and the big projects that align our efforts to our vision of best care for all. The specific priorities we select each year are arranged in three categories of work: longer-term transformation projects, shorter-term corporate projects, and in-year objectives. And you can see there on the slide kind of mind map of our strategic plan. It should be somewhat familiar to folks, and those three buckets are outlined across the bottom of the slide. So I'm going to spend the next few moments providing an update on each of those buckets, with an emphasis on our transformation program, which is really, I think, positioned to help HHS respond to sort of our biggest and most complex challenges. Next slide, please. Many of you will be aware HHS has made really big investments in equipment, technology, and new processes over the past few years. And so I think in many respects, the transformation program that we're on focuses on increasing the benefit or maximizing the return on the investments that I just mentioned, but also identifying longer-term approaches to supporting our workforce and clinical operations. So you can see there the big initiatives that we've got going under transformation for the next little while. So let me talk a little bit about each one of those. Care transformation is a transformation initiative that we've got going, and This project is really trying to respond to the shortages we've been seeing in some of the critical uh, um, areas of our workforce. And so, like in some respects, there just aren't enough people in the workforce to fill the needs of the organization in the way that we've historically filled those positions. So, we would love to have more registered nurses at HHS, but it's very challenging to get back to try to even think about getting back to where we were because there just aren't enough of those skilled workers in the workforce. So care transformation is very much about reimagining how it is that we're taking care of our patients with new teams of workers with different alignments of skill sets and trying to make sure that we're lightening the load for all of our workers by having the appropriate number of people in the workplace doing the appropriate work and making sure that people are practicing very much at the top of their scope. Next slide, please. I think as many of you will recall, earlier this year, HHS completed development of a 5-year equity, diversity, and inclusion plan. This 5-year plan is now being adopted as a transformation initiative in our strategic plan. We've got an EDI governance structure in development that will ensure we have the people, processes, and tools in place to put the EDI plan into action. The development of a strategic plan for HHS research is also now a transformation initiative in our strategy. So the groundwork for this initiative was very much laid by Dr. Yeshke over the past year. And as a next step, we are going to complete the research strategic planning process in 2024 and prioritize the next steps under that plan. This plan very much aims to build a strong identity and cohesive approach for HHS's research enterprise. And we are a research hospital after all, and we're trying very hard to make sure that research is integrated into almost everything we do at HHS. Next slide, please. Our Healthy Future, that project has been around for a long time. It is a long-term project, and it's essentially our infrastructure plan, and it remains an important part of our strategy. So in the coming year, the focus will be very much about completing or continuing to work towards completion of the work at West Lincoln Memorial Hospital. We're building a brand new hospital there. That project is going very well. We've pretty much completed the structure of that new hospital, and we're going to be focusing as a next step on sort of the exterior cladding and glazing and starting to do the interior work associated with the new hospital. So that's very exciting. The Juravinski Hospital redevelopment is also part of our thinking for the coming year. We continue to work towards getting a fully approved plan for the redevelopment of Juravinski. That is quite a long-term project. I think we're looking at construction beginning in 2028 and completing in 2037. Now, won't have to wait till 2037 for various elements of that to open up and become functional, but it is going to be a long-term project at the Juravinski site. Next slide, please. So last but not least is our initiative called Next Generation Quality Performance, and this is a new addition to our strategic plan. Again, just referring back to where I started, we have made some very significant investments in digital infrastructure, our new, the Odyssey project, a new Epic install. We have access to information in a way that we've never had before. So we want to make sure that our quality initiatives are taking advantage of the new infrastructure we've got in place, and are very optimistic this will take us to a kind of next generation of quality performance at HHS. So this project is aimed at taking advantage of that those new capabilities we now have. So let's move on to corporate projects. You can see our corporate projects there. There are 6 new projects to tell you about. The first is ambulatory optimization. This is, again, thinking about how we can take better advantage of some of the technology we now have in place with respect to ambulatory and empowering patients to be much more proactive in scheduling appointments and so on, and making sure that we're optimizing the use of our physical infrastructure and ambulatory. So that is an important project in the coming year. I think we would have informed you previously that there have been historic new investments in the Children's Hospital by the province. So making sure that we make the most of those investments over the coming year as that new money flows in. It is a project in the coming year that we'll be actively managing. We are doing a refresh this year of HHS's people plan. That's our plan for recruiting, retaining, engaging, and taking care of people who work here at HHS. We have had the current people plan, I think, has sort of seen its completion, and so we're refreshing that plan for the coming years. We have a new project in access and flow, making sure that patients are flowing through the organization and is in as optimal a way as possible. And we have a new project around community partnerships, which is really exploring how we can engage in partnerships to enhance service delivery, especially in surgery, given some recent provincial directions. And finally, a new digital health plan, because again, we've completed our previous 5-year digital health plan. There's so much going on with technology right now in the areas of artificial intelligence and big data. So we're imagining and planning for what we want to take advantage of and focus on over the next 5 to 7 years in digital health. Next slide, please. So I'm just going to finish by talking a little bit about our in-year objectives for 2023. These are the things, they're very patient focused for the most part, that we want to focus on for the coming year in terms of improving quality delivery for our patients. These are very much integrated into our approach for CQI. So all of these, or most of these, will ultimately be deployed to our frontline units for the frontline to be thinking about how we can do better in these areas. We have carried forward 4 in-year objectives from last year and added 2 new ones. So if we go to, well, I'll just review them. Hospital deaths following major surgery, pressure injuries, sepsis, and lost time injuries are all carryovers from last year. And then 2 new in-year objectives around increasing barcode medication administration and improving our performance in hand washing. So if we go to the next slide, we are making good progress across a number of these. Hospital deaths following major surgery, bed sores, and lost time injuries. We are all tracking to meet our objectives. For barcode medication admin and hand hygiene, we are making progress, but we still have some work to do. Sepsis continues to be a stubborn indicator for us, but I think we've got a very good work plan in existence to try to make some progress against that. That's the refreshed strategy for the coming year. And you'll continue to receive updates about our strategic plan in the weeks and months ahead. As always, you can visit the hub to learn more about HHS strategy and how we're doing against it. So I am now going to turn it over to Sharon Pearson for her regular update on hospital operations.
Great. Thank you very much, Rob, and good afternoon, everyone, and happy to be here to provide today's update. So we'll just go to the next slide, please. Start with our usual overview. It's not just COVID-19. We provided a little bit of other data today related to some of the seasonal illnesses that we're seeing right now. You can see our COVID numbers at the top there at over 100. As well as we do have some COVID activity in the ICU right now at 6 patients. You'll note the RSV activity as well as the RSV patients in ICU, which is less than 5, and then the influenza patients. In a few minutes, Dominic will update us on the trends in the respiratory illnesses and COVID that we're seeing, and hopefully have some good news for us. In terms of outbreaks, we're down to 4. 2 outbreaks have just been closed, so we had been at 6, so some good news there. If we go on to the next slide, just a little bit about our occupancy. I hope everyone saw our communication yesterday. Certainly the sites have been unduly pressured, particularly at this point, the adult sites, with exceedingly high occupancy rates, well into the 120s in some sites yesterday. And I know we talk about this each time, but a record high number of patients, particularly at the Juravinski site. We have seen those numbers subside a little bit today, but we are still at peak numbers in terms of some of our volumes in patients at our site. We've seen a bit of tempering in terms of the pediatric activity, although we still do see pressures within the neonatal ICU, and certainly always anticipate that we may see some seasonal increases at that site as well. Our ALC patient numbers, again, we're maintaining anywhere between the 250 and 280 at 270 today. Next slide, please. In terms of what's driving the capacity demands that we're seeing, certainly the respiratory and seasonal illnesses are the primary cause, along with the acuity that's associated with these populations. So consequence is we have more patients that are staying and not ready to go home. I did note the NICU pressures that, again, are outstanding at the McMaster site. Our ALC, in terms of how we compare to last year, we do see an increase in our percent of ALC patients, so up to 11% this year. And that is considering, of course, that we still operate the satellite health facility downtown. All of our post-acute sites have been maintaining maximum capacity through all of this and have actually moved to some hallway patients at times at the St. Peter's site. Next slide, please. The outbreaks, of course, continue to be a challenge as related to patient flow, and the teams are working with infection control to the degree to which is possible. We're certainly trying to minimize capacity that is blocked due to the infection control issues that we have. We are at this point still not at 100% of our pre-COVID volumes, but you see we continue to inch upwards. So we're at 90%, 96% rather, as related to surgical activity. And we are on track as we move forward into 2024 with our target to get to 115% of our pre-COVID. And just for all to recall, we are behind in our surgical and procedural work to upwards of 9,000 cases, as is everyone across the province. So we are trying to maximize and add capacity to catch up on the volumes that were deferred and lost through COVID. In terms of our health human resource position right now, certainly all of the active recruitment continues, as do the retention strategies. We do see some tempering of the vacancies in some areas across the organization, so that's good news. We still certainly have pockets where we still have significant vacancies and are working to mitigate for those gaps and continue to recruit. And all of the host of the ongoing care model strategies remain in place. Lots of work by the leadership team with our hospital and physician partners to really look at how do we mitigate these pressures for patients and for staff when there is such high occupancy rates across all of our sites as we try to get through this viral season. Next slide. Just before I talk to this, I just note that, of course, in response, we have had our corporate IMS meetings. We have another following this today to make sure that we have a collective understanding of the impacts across all of the enterprise. We did need to cancel some scheduled care yesterday. We have not had to do that today, so that's good news. But obviously monitoring that very closely and working very closely with our peers across the HNHBB and Ontario West as it relates to repatriation opportunities as well. In terms of some other good news, the burn unit, exceptional news. You see a nice photo up here of Dr. Jeske and the team from the burn unit at the Hamilton General. So we have reopened to all of our activity for burns. And so that regional program is up and growing. So great news. There was a communication this week about the opening of the new B3 step-down unit beds that go live on January 15th. So that's 9 new basic level 2 beds, which is wonderful news and well needed capacity that we require. And then lastly, we will be relaunching our ECMO program. If many will recall, we talked about the ECMO program a lot through COVID. It's an exemplar program for HHS. We have needed to pause for a number of months because of some health human resource challenges that we have. But we are reopening as of January 15th to provide what is a very critical service to our community and to the province. So some really good news examples of what's happening across our sites. And with that, I'll hand it back to Aaron.
Yeah, thanks very much, Sharon and Rob. Next up on our agenda today, we have Dr. Dominic Mertz, who's our Medical Director of Infection Prevention and Control, who's going to talk a little bit about the respiratory viral season that's underway, what's happening here in January and what's ahead. So Dominic, over to you.
Yeah, thanks, Aaron. Happy to share some of the trends that we see. Next slide, please. So quickly going into the activity of respiratory viruses locally, the impact on healthcare that Sharon already covered to a large extent, what it means for us at this point of time, and a quick look into the Omicron soup at this point that we have in Ontario. Next slide. So let's start off with the Hamilton Public Health data here. At the top, you see number of deaths of COVID-19 positive patients, and you see less of a signal than last year around the same time. However, in the second graph, you would see hospital admissions of Hamiltonians, and we are running higher than last year around the same time in terms of those. But we don't see any ICU admissions, which is a little bit in contrast to last year, where we had a couple of patients around those weeks over the holidays. At the very bottom, you see the wastewater signal for COVID-19 in Hamilton, which still runs higher than around the same time last year. Last year, the wastewater, as you can see, peaked couple of weeks from now, but it's hard to predict what's going to happen now. And I will get back to that when we talk about the Omicron soup. Next slide. Here you can see the ARI, so acute respiratory virus infection positive patients in hospitals across HNHB. You see highlighted the current 4 weeks and the same 4 weeks last year. We have higher numbers in hospital, and that's a combination of running slightly higher COVID numbers, but in addition to that, significantly higher flu numbers, as well as RSV, which is sort of after the peak, but is still hanging around. So we have the combination of all the 3+. additional patients with other respiratory viruses, but relatively small proportions compared to those 3 major viruses. So higher numbers than last year around the same time across all of those ARIs. Next slide. Talking about RSV in particular, these are inpatients at the Children's Hospital with lab-confirmed ARI, and you can see the total number there actually peaked end of November, mostly driven by RSV as we were used to and also saw last year happening. And you can see RSV continues. Flu sort of peaked end of December in the pediatric population, and COVID has relatively stable background activity when you look at the Children's Hospital since beginning of December. Next slide. Number of outbreaks. This slide hasn't been updated by Public Health Ontario, unfortunately, but up to the end of 2023, what I said before continued to hold true. We tend to run less outbreaks, that this is COVID specific, than last year around the same time. So that's the orange line there at the bottom of the highlighted area compared to the darker orange line, which is 2022, 2023. And then on top, you see the number of outbreaks that went through the roof, which was the Omicron wave in the winter of 2021, 2022. Next slide. ED visits show a decline, and that makes me think that we should be also in the adult population post-flu peak at this point of time. However, there's missing data here, so it's not as great as it may look like on this slide. But even with the missing data, it looks like number of cases with respiratory viruses presenting in the ED are coming down. Next slide. This is our local picture from our lab, HRLMP. You can see flu still quite prevalent across all age groups, positivity rate of 18.5%. At the bottom, you see COVID, slightly lower numbers, mostly in the young population, less than 5 and 40 plus, but that's also the population where we do much more testing. So that doesn't mean that there's less necessarily in the 5 to 40-year-old age group. RSV, as I said, declining, positivity rate 3.4% at this point. And again, we continue to see most cases that we end up testing in the less than 5-year-old population, which is typical for RSV. Next slide. This is the picture in the US, all ILI. So again, ARI activity across the US. You see quite a bit of purple and dark red here. So basically the ARI season is in full swing in the US, similar to what we see in Canada. Next slide. This is the US around the same time last year. As you may remember, in terms of RSV, we were already beyond peak. Same so for flu at this point, that we didn't have the peaks of flu and COVID at the same time. So it looked better last year around the same time. Next slide. The Omicron soup in Ontario, still all Omicron to start with. I highlighted here Omicron JN1, which is the one that we expect to be increasing. That's what you see on the next slide. And those are the estimates. Next slide, please. We estimate at this point that we have, since the end of 2023, a predominance of JN1, which is replacing HV1, which used to be the dominant sublineage over the last couple months. What that means in terms of trajectory over the next weeks in terms of COVID is very hard to predict, but what you currently see is probably based on the best estimates already mostly JN1 driven. Next slide. Okay, in summary, compared to last year around the same time, COVID activity in the community is slightly higher based on wastewater testing mostly, because we don't test a lot out in the community. We have slightly more COVID positives in hospital, but less in ICU and less deaths. So less severity, but more activity, I would say. Similar number of COVID outbreaks as last year. Flu A is now the most common ARI in the pediatric population. RSV is now second. So as I said, beyond RSV peak in the pediatric population. Flu A seems to have peaked in the pediatric patients and likely also in adults last week, given it was only last week. We cannot be entirely sure about the trend yet, but it looks like this is where we are heading, that things should get better from here, but it will take several weeks for flu to quiet down. JN1 is estimated to be the dominant COVID-19 Omicron lineage or sublineage at this point. And we will see over the next few weeks whether that means anything and at what point we might see the next peak in terms of COVID activity. With that, handing over back to you, Aaron. Thank you.
Okay, thanks very much, Dominic, for the update today. Okay, well now just a reminder that I think there is one question in there, Dr. Mertz, for you about what Minnesota might be doing differently. I'm assuming that's related to COVID, not other things. So you'll type an answer in there.
Yeah, I think that's in reference to the map for from the US that I showed, which last year as well as this year has green for Minnesota for overall ARI activity. I'm not sure whether it's a testing artifact. I haven't looked into that. Wouldn't make too much out of it. I don't think they are any different than the rest of the US, to be honest.
All right, well, thank you for that. And any other questions that someone wished to ask today? Just a reminder, you can continue to enter them in our Q&A function for the balance of our agenda today, or you can send those questions by email to hhsnews@hhsc.ca, and we'll be sure to get you an answer as quickly as possible from someone who can give it. Okay, so next up we have our celebrations portion of our agenda and the opportunity for our panelists or as well our participants to raise a hand and give a shout out live, or you can type it in the chat forum and I'll read it out for you. So we'll take any and all celebrations now. Leslie Gillies, I saw a hand go up and then go down. Don't want to put you on the spot, but maybe you had one. Just want to make sure I didn't miss it.
Thanks, Aaron. I just wanted to say congratulations and sincere appreciation to Marita Tonkin, who is our Chief of Health Professional Practice, who will be retiring shortly within the next month or two after 40 years of incredible and amazing service at Hamilton Health Science. And I've had the pleasure to work in different roles and capacities with Marita, as with many other people here at HHS. She's been an exemplary healthcare professional, serving as a clinical pharmacist, but also in many different leadership roles, most recently as a chief, but also supporting several accreditations, resulting in exemplary status with her colleagues and team members. So just sincere appreciation and thank you, Marita. I hope that she was able to join on, and all the best, well-deserved. Thank you.
Yeah, great stuff. Thanks very much. Deb Bettini, I see you with a hand up. What would you like to celebrate today?
I have a few, Aaron. One, I just want to celebrate Dr. Mark Yashke, Amy Williams, and Ellen Bagan for their leadership in bringing the burn program back up to our full capacity. Back in November 2020, we had to reduce down to less than 25% of body surface area. And it's so great to see with the team's work and the support from the team and how wonderful everybody's come together to make this happen. So kudos to everyone. Also wanted to thank the leadership for bringing back the VV ECMO, which is really supporting our respiratory patients. And that was under the leadership of Dr. Faison Amin, Kelly Gardner, Carolyn Dunnett, Amy Williams, and Anna Buss from the ICU, MedSurg ICU. And that was really a team effort with a lot of people coming together, perfusion, nursing, physicians, to make this happen. So again, kudos to them. And the third is I want to thank all of the Hamilton General Site staff and physicians for the work you're doing with our severe occupancy and everybody coming together to make it happen. And it takes everybody to do that. That's the frontline staff, the physicians, our support services, examples, X-ray, MDU, everybody to make this happen. So thank you very much.
Yeah, fantastic. Thanks, Deb. I see a couple other hands up. I just could read a couple of our chat comments ahead of calling on those panelists. We do have lots of recognition for Marita for her retirement, and then also to recognizing the satellite from Jessica Sylvester. I want to recognize all the satellite health facility staff for working very hard to keep all the 120 beds full to assist with acute site capacity, lots of flexibility and work. Amazing team. Also from Sam Jennings, a shout out to the inpatient units across HHS, supporting 100% plus capacity, lots of work to maintain flow and keep delivering the best care for all. Amazing. Okay, thanks. I saw Leslie Gauthier, you had a hand up, and then I see Bruce with one. But Leslie, what would you like to celebrate today?
Yeah, thanks, Aaron. I know the organization, we've been celebrating Pearl Venema's retirement, but it is really coming really close for us this week. And just want to take the opportunity to thank Pearl for all of her leadership with the foundation and the great things they've done to contribute to our patient care. I'm really, really appreciative of the opportunity to have worked with her for so many years, as I know many other people are. So all the best in Pearl's retirement, and we really look forward to working with the NISA going forward.
Yeah, fantastic. Thanks very much, Leslie. And Bruce, over to you. What would you like to celebrate today?
Thanks very much, Aaron. Rob mentioned the growing MCH corporate project, and we'll certainly hear more about that in the coming weeks. But I did want to just celebrate as we come out of 2023 the remarkable work by so many this past year to get us through what actually were similar numbers in terms of respiratory illness and pressure on our ED and pressure on our inpatient occupancy. And, you know, really it's across the board, but in particular, I'll call out the pediatric surgical leadership team, Les Gauthier, Laura Murphy, Devin Peterson, Elena Potts, Peter Darby, and so many more. We had, as I said, higher volumes this past year than previous than in the year before. But whereas in the winter of 22-23, we canceled 66% of our scheduled surgical activity in pediatrics. This year, we deferred by 1 day, one case, and otherwise we were able to get through the entirety of that surge while maintaining our pediatric surgical activity. So that's a pretty remarkable accomplishment, I think, by those leaders, and is helping us to bend the curve on children waiting. So my congratulations and thanks to those folks, and we're going to see more about that growth over the coming 12 months.
Yeah, thanks, Bruce. Some great news. Congratulations to all involved. Important for our community for sure. I want to also just acknowledge Kaylin Pettit. I'd like to acknowledge the collaborative and innovative efforts of HHS's talent management and communications teams in developing and launching a nationwide digital recruitment campaign that went live in November. It's already making an impact on the number of prospective new team members applying into vacant roles at HHS. Great work that's making a positive difference. Thanks, Kaylin, for calling that out. From Erica Casperson, thank you to all of our HHS peer supporters offering support to staff and physicians through the Beyond Silence Peer Support Mental Health and Wellbeing app. The app's available for download for free. So if you haven't already done so, please download that and check it out. Thanks very much, Erica. Some additional congratulations for Pearl and for Marita, of course. From Tammy Packer, kudos and bravo to all. Thanks to each and every one of you for all that you are doing and have done and will do all day and night. It's truly phenomenal. Yep, some more if I could just also acknowledge, I want to really thank the team that was involved in rolling out this year's My Voice Matters survey. You may have seen in the questions and ask about the results for that, which are starting to roll out in the weeks ahead, heading to leaders in February and then to the rest of the organization shortly thereafter. Really want to call out the work of the team that was leading that, in particular, Roseanne Bernard, Megan DePutter, Owen Malui, as well as Anya Ledbetter. Really great work. I can scoop the results a little bit and just let everyone know our participation rate went up, and so did our results in many important areas. Always work to do, but I think it'll be a great story for the organization in terms of us heading in the right direction. So thanks to everyone that was involved. Leslie, you're back.
I'm back.
What would you like to celebrate today?
Yeah, so this is for diagnostic imaging. People may or may not be aware, but there is a very big initiative happening across Ontario West to look at centralized intake for referrals. Sarah Adams is leading that work with a physician from London Health Sciences. But who I really wanted to acknowledge is the work from Pratibha, Michelle Lafleur, Kaylin Pettit, Robin Simmons, and they worked with Sarah over the Christmas holidays to put together an HHS submission to be a host hospital for that work. We won't know the outcome for a little bit of time, but really, really good teamwork, and everybody raised to the challenge of doing the work over the Christmas holidays, and very appreciative of HHS for all of the efforts, and fingers crossed we'll be successful in our application.
Nice. Thanks for making that celebration. Okay, well, I see there's lots of action in the chat forum. Really nice to see today from everyone, and thank you for the celebrations. But I think we'll call it there. And Rob, I'll turn it to you for closing remarks.
Thanks very much, Aaron. And yeah, I thought today's section on celebrations was great. Lots of great shout outs. Just reiterate my own thanks and appreciation to everybody who's helping us get through this respiratory infection season, which has proved so challenging, seen some historic high occupancy levels, and I know how much stress that puts on all of our units. So thanks to all for helping us to get through that. Hopefully we have seen the worst of it, and we can look forward to some lower occupancy levels. But in the interim, thanks all for all the hard work that you're doing. Our next town hall is scheduled for February 1st. Thanks all for being here today, and I look forward to seeing you all back on February 1st for a further update on how things are going. Thanks all.